Creatine is one of the most popular and most demanding supplement there is right now in the fitness industry. But as it goes, there are a lot of stigmas and a lot of rumors about its side effects profile. As a doctor and as fitness enthusiast, I would like to clear these stigmas and rumors about this product. People are confused. People are scared to take this product, though it is very useful and very proven to be beneficial for muscle gain and all. People are very much confused about its side effect profile, for what age to start it from, whether they should start it in their early 20s or late 20s. Hopefully by the end of this video, you'll have more clarity about this creatine, and hopefully it will help you. So without any further ado, let's get started. What is creatine? Creatine is naturally produced in our body or naturally present in your body. Creatine has a structure very similar to amino acids, and amino acids are the basic units by which proteins are formed. So creatine has a structure very similar to amino acids, and it is also produced from amino acids, namely glycine and arginine, in our liver and kidney. Almost 95% of creatine in the form of phosphocreatine is present in our muscles, and 5% of the creatine is present in our brain and testes. 50% of creatine is produced in our body, whereas 50% comes from the diet, especially from red meat and the seafood. This information is especially useful in when it comes to vegetarians, because vegetarians don't get creatine from the diet, so they are solely dependent on the creatine which is produced in their body, especially in kidney and liver, from the amino acid glycine and arginine. How does creatine work? ATP is adenosine triphosphate. ATP is the basic unit of energy which is used by our body to do work. So whenever there is some high intensity workout, we require more ATPs. The more intensified the workout is, more ATPs we require. So the number of ATPs is directly proportional to the higher intensity of workout you can do. So this creatine provides that extra amount of ATP that is required to perform higher level of a higher intensity of workout. How does it do that? When ATP is basically converted from ADP, which is adenosine diphosphate. Di means 2. So this ADP has 2 phosphate groups, and when it is converted to ATP, which is the active form or the energy unit, it has adenosine triphosphate, which is 3 phosphate groups. So when there is adenosine diphosphate is there, this creatine, which is stored as phosphocreatine, has an extra phosphate group. So whenever this ADP is there, that is adenosine diphosphate, this phosphocreatine breaks down and gives this one phosphate group to adenosine diphosphate, which has 2 phosphate groups, and converts it to adenosine triphosphate, as in 3 phosphate groups. So it becomes ATP, energy unit of our body. So there is more amount of ATP available so that you can do more amount of intensified or high intensity work. How does creatine help in muscle gain? So there are many mechanisms proposed when it comes to muscle gain via creatine. As we already know, creatine is stored in our muscle cells as phosphocreatine. Creatine basically helps us to do more amount of work or increased volume of work per session. So when it adds up, per session adds up in long term, it leads to more growth of muscle. It also stimulates satellite cells or satellite pathways to stimulate more muscle growth. It stimulates more anabolic hormones like IGF-1, as an insulin-like growth factor 1, which is very useful in muscle building in our body. Also, it prevents breakdown of muscles during workout, so there is less breakdown of muscle and our already formed muscle is preserved. It also antagonizes or opposes the effect of myostatin. Myostatin is the enzyme which promotes muscle breakdown. This creatine halts the activity of myostatin and thus prevents the breakdown of muscle, and thus we retain the already formed muscle, and long term, when we think about long term, our muscle building is improved. Apart from muscle gain, creatine is also proved to help brain function. Since brain's main energy source is ATP, or brain requires a lot of ATPs to perform its function, this phosphocreatine or this creatine helps to provide those extra ATP and brain can function well. This especially is proved to help in mental diseases or brain diseases like Alzheimer's disease, Huntington's disease, Parkinson's disease, brain or spinal cord injuries. The creatine helps in improving these conditions or overall life condition or overall life quality or overall living quality of this conditioned patients. Also, it helps for a better memory and better quality of life or better muscle strength in older people. As we grow old, the memory function or the brain function deteriorates, also the muscle function deteriorates. So it is shown that if you take creatine in older age, it helps in retaining the memory status, and also there is better muscle activity in older people, and hence it improves the quality of life. Please note that this doesn't have enough support or doesn't have enough experimental or not enough studies are done regarding this, whether creatine really helps in brain function or not. Most of the studies are done in animals, and yet there is yet to be studies to be done more in humans. How do we take it? There are two phases by which we can take creatine or supplement creatine. One is loading phase and other is maintenance phase. Loading phase is basically you take 20 grams of creatine, which is 4 times a day, as in you can split it as a 5 grams of creatine 4 times a day for 5 to 7 days, which saturates your muscle by a phosphocreatine. Next is maintenance phase. In maintenance phase, when you're done with the loading phase of 5 to 7 days, you take 3 to 4 gram of creatine and supplement it daily. That is just once per day. 3 to 4 grams of creatine once per day, which steadily maintains that saturated level of muscle phosphocreatine in your body. The importance of loading phases: the action of phosphocreatine starts faster, whereas if you just start with a maintenance phase, skipping the loading phase, for the effect of creatine to show you, it might take 3 to 4 weeks. There are a lot of different types of creatine available in market right now, but one of the most important and well researched amongst them is creatine monophosphate. Creatine monophosphate is very much well researched, and it is also the cheapest form of creatine that is available in market right now. So I would suggest you to just go for creatine monophosphate and skip the other forms of creatine. Let's talk about side effect profile of creatine. Creatine is a very well researched supplement that is available in market right now, and its risk to benefit ratio is very high, as in its benefits compared to its side effects are very much higher as compared to its price also. Creatine costs very less as compared to other supplements that are available right now in the market, but it has very low side effect profile, and it also is proven to give you more benefits as compared to other supplements. So what are the side effects we should be worried of? Creatine is mostly synthesized in liver and kidney, and also it is excreted via kidney. So people who are already predisposed to these diseases, or people who are already having diseases related to liver or kidney and are taking some medications, should definitely consult their doctor before taking creatine as a supplement, or they should basically try to avoid creatine or take it via your doctor's consultation. Other side effect people are worried about is cramping and dehydration. Yes, creatine does pull some water into the muscle from our extracellular compartment, but it is not enough to cause dehydration and cramping. Well, some of the studies do suggest that creatine does help in preventing cramps and dehydration while having high intensity workouts. So this also is just a rumor and not true. Just make sure that whenever you take creatine, you at least take 3 to 5 liters of water per day. Please note that whenever you are on creatine supplementation, your serum creatinine levels might be high. If you do a blood test, your serum creatinine levels might be high. So just note, it's not creatine, but it is creatinine. Creatine is excreted, or creatine is converted to creatinine to be excreted via kidneys. So whenever creatine has to be excreted, it will be converted into creatinine, which will be flushed via kidneys. So whenever you do a blood test, your serum creatinine and not creatine levels will be high. So don't be scared of that. It's nothing abnormal. Since you are taking creatine supplementation, the serum creatinine levels will obviously be high, and it does not indicate towards any renal disease. Other most important side effect or rumored side effect is creatine causes hair loss, which is not entirely true, but it is proven that, or it is said that creatine actually increases the level of DHT, or which is also called as dihydrotestosterone. This dihydrotestosterone is the basic cause of this male pattern baldness or alopecia. So creatine increases DHT, which in turn causes hair loss. which is not entirely proven yet, but I would still advise people who are already facing problems of hair loss or losing hair, they should avoid taking creatine supplementation, just in case, to be safe. Who should be taking creatine? Creatine is actually safe for all age groups, even the young age group, teenage self, the adults one, and even it is specially proven to be beneficial in older age groups. But from my personal experience, I would like to suggest people to take creatine about 20 years of age or after 20 years of age. Why is it so? Because after 20 years, you have made some progress in gym. You have just crossed the basic level of fitness in gym. So creatine helps you to do that extra level of work to push yourself when you have reached the plateau. After working out for so many years and building that muscle, you will find it hard to grow more amount of muscle, or you will find hard to do high intensity workout. So that is the time you need to supplement with creatine, and it can do wonders for you. Basic point is, please start taking creatine after you have crossed 20 or 21. Don't take it at too young age. Try to get your basics right, try to get your form right, and once you cross that age, once you hit that plateau of your muscle building, this creatine supplementation is going to give you that extra boost or extra volume of workout, so you can work out better and you can push your limits. That's all, guys. That was all about creatine. It is a very safe supplement, and its price is very low, and its benefits are compared to price and risk, its benefits are very high. I hope everything is clear about creatine, and you will safely take it, and as advised, please take it in a advisable dosage form or advisable dose, that is like 3 to 4 grams per day. Don't take it more than it, and also supplement it or take it with ample amount of water, that is 3 to 5 liters of water per day. If you do this, I assure you there is no harm to your body or no organ damage will be done. So with this, I'll finish my today's video. Thank you so much. Tada.